Oh, sorry. Can you see the presentation? Yeah.
Yeah.
Okay.
Now, yes.
Thank
Now,
you
yes.
very.
You can go ahead.
Yeah.
Yes. Go
Yeah.
ahead. Go ahead, please.
Okay. Thank you. So thank you very much, Emmanuel, for the presentation. And well, I'm going to present this research carried out at the Agri-Food Research and Technology Center of Aragon in Spain, in collaboration with my colleagues Hugo Ferrer, George Philippidis, and Ana Isabel Sanjuan. So this paper, as Emmanuel said, focuses on the Sustainable Development Goals, the SDGs, that provides global targets to be met in 2030 with relevant metrics for the identification and monitoring of the 3 pillars of sustainability: economic, social, and environmental. And the use of CGE models for foresight studies is a very useful tool of analysis in this field of study, especially when one considers the SDG trade-offs arising from the interaction of different policy measures. However, the coverage of SDG indicators in CGE models is typically restricted to market-driven indicators, whereas the social dimension indicators remains almost neglected. So the aim of this research is to provide an initial step for improving the social SDG coverage of CGE modeling. And in particular, the objective is to implement econometric models of drivers for health, the SDG number 3, and for education, the SDG number 4. In order to provide parametric inputs for global CGE simulation models. Thus, in a first step, we examine the literature to identify relevant health and education indicators and relevant drivers for each indicator. And then we construct a global panel dataset for our selected drivers and indicators based on different secondary data sources. And finally, we estimate econometric models to determine the magnitude and direction of these drivers across regional groupings. And these elasticities, as I say, can be very useful, can be used as parameters for simulation models. So first, the selection of the indicators to measure the progress of SDG 3 and 4 was based on the Global SDGs Indicator Framework developed by United Nations. And among the proposed indicators, we select 3 indicators to measure the health goals and 2 indicators for the education goals. So for the health indicators, we select first life expectancy at birth, which is a global measure of health conditions. Second, we select the survival ratio for newborns and also for children between 0 and 5 years in order to measure the target 3.2. And third, we also select the fertility rate for women between 15 and 19 years old in order to measure the target 3.7 of the SDGs. And also regarding the education goals, we consider the mean years of schooling for people between 20 and 24 years old, trying to cover the school-age population. And this indicator was considered both for male and for female population. So we can also obtain the gender gap in mean years of schooling, which relates to target 4.5. The data source for all these indicators is the Wittgenstein Human Capital Data Explorer database. And we select this data source because it offers historical data since 1915, but also it offers projections up to 2100. And thus it can serve as a reference for economic simulation models. In this figure, I try to present the geographical pattern for the life expectancy at birth in 2015, and we can observe the existence of correlations across neighboring regions and the presence of spatial clusters of regions with similar values. For example, in sub-Saharan Africa or in Europe or also in Latin America. And here we have a very similar figure, but it's not the life expectancy, but mean years of schooling. And we can observe a very similar geographical pattern than for life expectancy, with clusters, for example, in sub-Saharan Africa or in Europe or even in Latin America. And the same result is also obtained when we map the other indicators. So to confirm this geographical pattern, we have implemented the Moran's-I test that confirmed the existence of global spatial positive autocorrelation with spatial clusters around similar values. So according to that, the results that we obtained in this study are presented for the following 4 clusters: the OECD, Latin America and Caribbean, the Sub-Saharan cluster, and the rest of Africa, Asia and Pacific cluster. And these clusters were formed taking into account the country's proximity and its level of development, but also we have considered the availability of enough observation for the econometric estimations. So once we have selected the SDG targets, an array of drivers need to be considered, and this selection was based in a review of the literature, but also in the availability of relevant variables in CGE models to proxy these drivers through market-based indicators. So the drivers we finally consider are the GDP per capita, also an education variable, which is proxied through the mean years of schooling for the health indicators, and through the share of public education expenditure on GDP for the education indicators. We also consider the share of agricultural sector on GDP as a proxy of rurality, and the daily per capita food consumption. Environmental conditions are also considered and measured through the air pollutants per capita. We also consider the institutional conditions captured by a relative openness index, which is measured as the ratio between the country's share of trade on GDP and the world's share of trade on GDP. And also inequalities are introduced in the model as the Palma ratio, which is constructed as the ratio of the richest 10% of the population's share of gross national income divided by the poorest 40% share. And finally, the per capita GDP variable and the food consumption variable are also introduced in the econometric models in quadratic form when its effect is shown as statistically significant, in order to capture the different effect that these drivers can have for different values of the variable. I mean, for example, when although an increase in food consumption could enhance life expectancy, an excessive caloric intake could reduce it. And in a similar way, the literature maintains that life expectancy rises as income grows, but at a declining rate. So these quadratic variables try to capture this effect. And data for all these variables are drawn for the World Bank Development Indicators database, except for the food consumption that comes from the food balance sheet of FAUSTA database, and the air pollutants information that comes from the air pollutant database from the Joint Research Center. The methodology used in this paper is based on an econometric approach that allows to obtain elasticities to understand the relative strength of each of the drivers that we consider. So a panel data approach with country fixed effects is used to assess the impact of SDG drivers, allowing to measure the relationship between variables, but after controlling for the country heterogeneity. We have information for 149 countries for the period 1990 to 2015. And among the possible model specifications for the continuous indicators, which are life expectancy at birth and mean years of schooling, we use the double logarithmic model because it permits nonlinear relationship between the variables, and because the parameters of the models can be directly interpreted as elasticities. And for the fractional indicators, the percentage indicators, which are the survival ratio and the fertility rate, we use a beta regression model because of its flexibility for modeling continuous dependent variables that are between 0 and 1, and because the prediction of these drivers are limited to the same range, between a range between 0 and 1 also. So now I'm going to present the main results of this paper, and this table presents the elasticities for the life expectancy at birth for all the countries in the sample, and also for the OECD cluster and the sub-Saharan cluster. The results for the other cluster that are Latin America and the rest of Africa, Asia and Pacific are also in the paper, but I'm not going to present these results them for simplicity. So as expected, income level and education positively influence life expectancy, and specifically a 1% increase in GDP per capita and in mean years of schooling leads to an increase in life expectancy of 0.21% and 0.16% respectively. And results by region show a greater impact of these variables in sub-Saharan countries than in OECD ones. The results also corroborates the hypothesis regarding the greater accessibility to public services on urban areas than in rural ones. I mean, an increase, a 1% increase in the share of agricultural sector on GDP is shown to reduce life expectancy by 0.21%. And this accessibility effect is more pronounced in sub-Saharan Africa. We also observe that air pollutants per capita has a significant effect, a negative on life expectancy, both at global level and in OECD countries, with elasticities around minus 0.03. But in sub-Saharan Africa countries, the effect is not significant. And the other drivers considered, that are the food consumption, the openness index, and the Palmer ratio, are not statistically significant, although they have the expected sign. Here we have another table with the elasticities for the newborn survival ratio. I'm not going here to present the results for the under 5 survival ratio, but the results are very, very similar to those for newborn. So we see that caloric intake is the main driver of child survival ratio, with an elasticity at global level of 0.14. And this effect is particularly pronounced in sub-Saharan countries, although the impact of this variable is progressively weaker as per capita consumption of calories increases, as you can see by the negative coefficient of the quadratic food variable. The other variables with the next highest impact are education and the share of agricultural sector, which exhibit a similar magnitude but have the opposite sign. And here again we observe higher elasticities in sub-Saharan countries than in OECD ones. There is also a positive relationship between per capita income and child survival ratio, although we can see that this effect is more limited than for other drivers, and moreover, this effect tends to be softened as per capita GDP increases, as you can see in the negative coefficient of the quadratic GDP variable. We also observe a negative but weak relationship between inequality and the survival ratio. And finally, the other drivers consider the pollution, the pollutants and the openness index are not significant. Here we have the results for the adolescent birth rate, and the main driver is education with an elasticity of minus 0.05. However, you can see that the results by region show that for the OECD countries, the effect is not statistically significant. Rurality is the other factor that has a very relevant impact on the adolescent birth rate with an elasticity of 0.04. And also the effect of GDP per capita is statistically significant, but again, you can see that this magnitude is limited in comparison with other drivers. And only in sub-Saharan countries do we find an elasticity with a similar magnitude comparable to other drivers. Although also you can see that this effect tends to soften as the income level increases. Finally, the other factors, the openness variable and the Palmar ratio, are not statistically significant at global level, although you can see that globalization has a significant and negative impact on the adolescent birth rate in the OECD countries. And the last indicator for the education SDG is presented in this table, both for female and male population. So a first comparison of the results show that the elasticities obtained for the female population are higher and more significant than for males. And this suggests that the future socioeconomic development will tend to reduce the existing education gender gap. Both for male and female, the main drivers of the education indicator are the share of public education expenditure on GDP and the income level. Although you can see that the latter effect is found to weaken as per capita GDP increases. The share of agriculture on GDP and the per capita food intake also have a positive effect on education at the global level, but at regional level, we observe that the impact of these variables in the OECD countries is not statistically significant. And finally, the other variables, the openness index and the Palmar ratio, unfortunately, have a very limited effect, and the elasticities are usually non-significant at a regional level. So to summarize, this research aimed at assessing the drivers of relevant indicators of health and education SDGs, and the results obtained provide very relevant information about the rationale that guides the evolution of these indicators, both at a global level and for different regions. And the elasticities obtained also are a first step for the integration of education and health indicators into CG simulation models. And now we are working on this issue. In particular, my colleague George Philippidis is working on that, trying to introduce these indicators into in the magnet model. And here it should be considered that here we face the issue of reconciling a partial equilibrium econometric estimation with a CG simulation model complete with its second round feedback effects, etc. So this requires some degree of adjustment of the elasticities that we obtain, because although the parameters are in log terms, the different structural approach that are used means that it is possible that the indicators can be overestimated or underestimated as we move through time. And finally, in this slide, I present a summary of the results. I present the different elasticities for the different indicators and the different regions, but in absolute terms, in order to illustrate two main conclusions of this research. The first conclusion is that the elasticities tend to be higher in sub-Saharan countries, the yellow bar, than in OECD countries, that is the blue bar. So this means that at the margin, the efforts in less developed countries could lead to greater increases in health and education outcomes. And in particular, we observe that the elasticities for the food intake and the share of agricultural sector for sub-Saharan countries are particularly high in comparison with other regions. And this highlights the importance of adequate food and agricultural policies in this continent for ensuring food policy and also food security. And the second conclusion is that besides the significant effect of the GDP per capita on almost all indicators, the impact of other drivers, for example, the education driver or the food intake or the share of agricultural sector on GDP, have a similar or even a higher effect than the income level. However, we also conclude that the impact of pollution, trade openness, and inequality is weaker. And in most cases, we observe that these elasticities are not statistically significant. So with that, I find my presentation. Thank you very much for your attention, and all your comments and suggestions are very welcome.